My name is Michael Torres. I'm a medical doctor. I am the Vice President and Chief Medical Officer at AdventHealth Ocala. In my role at AdventHealth Ocala, I am responsible for patient safety, healthcare quality, risk management, the pharmacy, medical staff services, clinical informatics, which is the electronic medical record and how things are documented in the record, as well as oversight of all the medical care that's provided in the hospital. So peer review, quality assurance, all of that aspect of making sure that the medicine that's practiced in this hospital meets the standard of care. That's my responsibility. You know, it's interesting when we find ourselves dealing with crises, people rise to the occasion or wither. And what I have found here is that the medical staff here, along with the nursing staff, has risen to the occasion. I see people pulling together as a team, doctors and nurses working together collaboratively with the technicians, the paramedics, and others. I see people who routinely would work in an office volunteering to go pass food trays or give water or help people walk in the hospital. It is truly awe-inspiring to see the people of this hospital and this community come together. When we ran the Paddock Mall Immunization Clinic in partnership with the county and the health department and all the partners that were there, including the Paddock Mall leadership, it was inspiring to see the number of people that came together to make sure that the community was immunized and was protected against this virus. So it has been gratifying to see the rising of teamwork. At the same time, it's been distressing to see the fatigue, the total depletion of resources inside the people that are, in the COVID units dealing with those patients. Watching, at first, the elderly, but now with this latest Delta variant, watching young people die, with this disease. It's, when you hear of individuals who pass, who are younger than your children, you begin to realize that this epidemic is truly, it is something that is not discriminatory. We see race, color, creed, or age not being a factor. If the disease grips you, you're in its crosshairs, and you need to do everything you can to protect yourself. The biggest challenge that we've had to overcome is the tremendous lack of scientific knowledge in the beginning of every phase. When the virus first came out, and then when the Delta variant came out, we had learned how to do things for the previous variants of the virus, and they weren't working. And so we found ourselves having to try and fail, try and it wins, and discovering what worked along the way. Meanwhile, suffering from the moral and emotional distress of we tried everything, but they didn't survive. That is discouraging. And so certainly for myself as a leader and the rest of the leaders in every hospital in the country, we're out there, with pom-poms, rah-rah, trying to pump people up to make sure that they understand we appreciate you for doing your best. Okay, there's nothing wrong with trying and failing. Okay, what's wrong is not trying. Right? And we are all trying. We're all trying hard. And sometimes we feel like we're making it up as we go along because this is such a new disease. And to me, as a physician, that's been the hardest part. Balancing the COVID versus the non-infected patients has become difficult. And here at Advent Ocala, we were very lucky for a long time in that we had developed a 52-bed COVID unit. Myself, our chief operating officer, our environmental engineers, our engineering department, our nursing leadership, we all got together and we figured out where there was a place in the hospital where we could create an entire floor that was negative pressure, where we could separate the airflow from the rest of the building. And we did that. And so until we got beyond 52 patients, we were able to put 52 people in that unit. And we segregated that unit into the 3 levels of care: general medical surgical level, progressive or intermediate care level, and then the intensive care level, all in one floor. But today we're at over 100 patients. And so we've gone beyond that. We have been out into the community holding forums at churches and at large employers where we are answering questions. And, look, our country has a belief of rugged individualism. Our country has a belief of each person being able to think for themselves. I support that as an American. But I don't support making a decision that is going to be harmful to yourself and the people around you. And so the science points towards getting vaccinated. The science points towards barriers for exhalation, masking, or inhalation, masking. Okay? Is there rigorous proof? No, not yet. Okay. Now, if you're wearing an N95 respirator mask, absolutely. But to wear some other form of mask, cloth, surgical mask, it is clear that it cuts down on particle release, and it is clear from the science that this is an airborne illness. And so if we can minimize how much is being airborne, every one of us has seen the video on television of someone sneezing in high-speed slow motion. Okay, it was filmed in high speed and then slowed down. And you can see what spews out of the person that sneezed or coughed. All right, the mask stops that from getting this far away. When we see that greater than 90% of the people in our hospital who are struggling with really bad COVID illness are not vaccinated. All right? When we see that the individuals that are vaccinated almost never have to be hospitalized, and when they are, very few, if any of them, struggle with serious illness. They're not in the ICU. They're not getting put onto a ventilator. I wish that the people in the population would understand the level of suffering that is happening with people who are ravaged by COVID, the suffering of the patient who's ravaged, the suffering of the family members. I'm aware of a situation where someone lost their husband on the same day that their son was intubated and placed on a ventilator. The amount of emotional distress that the people that are left behind feel. I've lost family members. I think about my lost family members. It is, and the other thing I would say is that to protect the family, we don't let them in until the moment of death. We're being humanitarian. We're letting them in. We're gowning them up. We're putting them in an N95 respirator mask. We're giving them a face shield or goggles to protect their eyes because we know the particles can get into the body through the eye. So we're doing that, and we're letting the family in when someone's at the stage of this is terminal, they're dying. But not before that. So they don't even get to see them until their last moments. And that's to protect the family from this disease because it is airborne. People need to understand that this is different than anything. I've been a physician since the 1980s. This is different than anything I've ever dealt with in my career.